Hello everyone. Now I'm going to talk about febrile neutropenia. Febrile neutropenia is one of the most common and deadly adverse effects of chemotherapy. So it is very important for the cancer patient to understand febrile neutropenia. What is it? Febrile means high temperature, fever. That is usually indicated by body temperature of higher than 38.3 degrees Celsius. Neutropenia is low neutrophil count, a condition that infection happens when neutrophil count is low. This can be a very serious oncology emergency. Why does it happen? First, we need to understand the physiology of blood. So here's a person, and we will take some blood out of the person. And the blood will be put under microscope, and then we will see the blood like this. So the red is the red blood cell. This white, bluish ones are the white blood cell. The most and these little pieces are platelets. So usually in our blood, the red blood cells count is between 4.7 to 6.1 or 4.2 to 5.4 in male and female accordingly. The platelet count should be between 150 to 400. White blood cell count usually is between 4 to 11. Neutrophil usually is between 1.5 to 8.0. Okay, notice here, white blood cell count and neutrophil count. Neutrophil is a type of white blood cell. So so our body have stem cell. Our bone marrow will produce stem cell, and some of the stem cells will differentiate into common myeloid progenitor, and some of them will go to the lymphatic system, become common lymphoid progenitor. In the lymphatic system, the common lymphoid progenitors will eventually differentiate into all those types of lymphatic blood cells, also white blood cells, like natural killer cells, T cells, B cells, plasma. On the other hand, the common myeloid progenitors will differentiate into megakaryocytes, which will eventually become platelets, red blood cells, and myoblast. Myoblast will eventually become basophil, eosinophil, neutrophil, and monocytes. Neutrophil usually is flowing in our body mostly and then like if we have an infection, they will be arriving at the site the fastest. And later, monocytes could become macrophage in the late infection, like clean up. So in our body, our temperature is regulated between 36.5 to 37.5, give or take, up and down. And our red blood cells and the white blood cells, platelets, all flowing in our blood. And neutrophil is usually the ones that surveillance our body to try to catch any infections before it becomes very severe. Okay? And if we have a pathogen, say a bacteria, come into our body, and they will start replicating, multiplying, and then our body recognizes, oh, there is some intruders. So our body will create some of the factors that will cause the body to do some immune responses, such as alert the body to start warm up, like increase the temperature. Temperature goes up, and and also will tell the white blood cell to increase their counts. And neutrophils counts will go up, white blood cells will go up, and they will, as like bacteria continue to grow, the white blood cells will come and attack them. Eventually, will eat them up. And once all the white blood cells are taken down, the bacteria or pathogens are taken down by white blood cells, the alert is going off and the body temperature will come back. And white blood cells will also go back normal. When you receive chemotherapy, so when a person receiving chemotherapy, the toxin from the chemo will come into our body to kill the bad cells, like the cancer cells. But the collateral damage is to wipe off a lot of our normal cells, like the blood cells. The white blood cells can be taken down too. So in that kind of case, we don't have enough white blood cells or neutrophils in our body. And when the bacteria comes into our body, we don't have anything to defend it. So sometimes it will our body still recognize there's intruders. So the factors could cause an immune response. However, it is not mounted. So our body will be high in fever. Still, we have a little bit white blood cells, but it's not going to do much. So we cannot control the growth of bacteria. It will become very, very bad. So what can cause neutropenia? Chemotherapy can cause it. Radiation can also kill our normal blood cells. Malignant tumor infiltration into the bone marrow. Cancer affecting bone marrow, such as leukemia. Medications, for example, some antibiotics, anti-inflammatory medication, and a lot of immunosuppressant medications can also reduce our neutrophil count. Autoimmune disease, such as AIDS, can also decrease our neutrophil count. Some elderlies, age of over 65 years old, may also have low white blood cell counts. So if your febrile neutropenia is untreated, what will happen? So if we have too much bacteria in our body and it's not treated, then people may develop altered mental status. Heart rate will go up and blood pressure may drop. So the systolic blood pressure, which is a higher number, could drop below 90 millimeters mercury, or sometimes the systolic drop more than 40 millimeters mercury. Huge drop. It will also cause short of breath, tachypnea, and then difficulty breathing. So the respiration will become over 22 breaths per minute. And also it can also decrease urine output. The patient may feel burning urinations. And of course, at the end, the temperature may be very high, or some people, because they're not mounting the immune system because they don't have enough white blood cells, their temperatures could be low. And this is called sepsis. It is a medical emergency. Treating febrile neutropenia. So we are going to give, when a patient with febrile neutropenia comes to the hospital, the first thing they will get is a broad spectrum of antibiotic. The antibiotic will start to kill off some of the germs, the bacteria. And when the bacteria are gone, the alert is off and temperature will come down. It is very important to identify the source of infection. So it is important to know that some of the infection sources could from a recurrent infection, which means prior infection. Some people may have open wounds, say surgical sites. For example, like some people have cancer and they have surgically take a biopsy, or could be surgically removal of the tumor. Urinary catheters, drains, or IV sites. Like a lot of patients may have IVs, PICC lines, apheresis, central lines. These are portals of entry to infection pathogens. So basically that means like bacteria or virus can enter into the patient's body from such open sites, like some locations. Obstructions of the lymphatic systems, bronchial systems, GI systems, urinary systems, or biliary tract, which is the gallbladder duct, including gallbladder duct. Hospital stays may expose to pathogens and also contact with persons. For example, the patients like have family or friend visited with some like flu, and then they could catch it. So when a patient is experiencing new onset of pain, change in mental health, or fever, chill, sweat, stiff neck, sore throat or cough, short of breath, change of urinations, vaginal discharge, diarrhea, constipation, vomiting, and like a redness, soreness, or swelling at wounds or pores, like for example, like IV sites, they become swollen, red, and painful. The patient need to tell the nurse right away, okay, or the doctors, or go to ER emergency right away, because all these things could be signs of infection. Well, what should the patient do? The patient should call the doctor, the nurses right away, or if they're at home, they could contact the cancer center. Go to the emergency department and tell the nurse 3 things, very important. You have cancer, you are on chemotherapy or radiation therapy or any other therapy that's treating cancer, and you have a fever. And they will not keep you that very long in the emergency, because we all know emergency has a lot of sick people and they carry a lot of germs. They will take you to some place that is more protected to prevent further infections. The shorter you stay in the hospital, the less chance for a second infection. So it is very important for the patient to understand